Hello. You're welcome. Today's topic centers on natural remedies for infertility in women. It's cost-effective, realistic and achievable. If you stay to the end, I will be sharing a fertility-boosting recipe that you can take to achieve great results. Fertility can be described as a natural process in the body. If there's a disorder or imbalance, the body may choose to switch off if it doesn't feel it can safely keep a pregnancy. On the other hand, infertility is simply saying that something is not right inside the body and should be reversed or cured. An infertile woman is one who is unable to become pregnant after a year of sustained sexual intercourse with the opposite sex or 6 months for a woman over 35. There are so many attributing factors that can cause or contribute to infertility, which is why traditional, conventional and orthodox medicine can vary so much in its effectiveness. Thus, it may not address all the possible causes. The intake of fertility drugs and synthetic hormones of any kind can make underlying problems better as well as make them worse, and fertility in the future more difficult. Intensive fertility treatments can work for some women, but can be somewhat emotionally and physically exhausting, and highly expensive. Infertility can be as a result of many factors which can be interrelated or independent. These factors include hormonal imbalance, polycystic ovary syndrome, PCOS, endometriosis, anovulation, physical blockage, insufficient hormone production, not too long luteal phase, inadequate of luteinizing hormone, increased levels of prolactin, and many others. In our day-to-day activities, you may know persons who are finding it difficult to conceive. It's quite heartbreaking when you see some family members or friends who have struggled to conceive and nothing seems to work. I've noticed how painful it is for them to become parents and the effort they have to make to get pregnant. Fortunately, a number of them were able to conceive through lifestyle adjustments and nutrition. What do you need to know about infertility? In some situations, the body can reverse infertility naturally if given the required attention. Isn't this good news? Yes, It's best to note that the information I'll be providing is for educational purposes. It is still very important to check with your doctor or specialist for infertility problems and to tackle any potentially serious underlying health problems. However, some women also benefit from working with a holistic nutritionist, dietitian, doctor or specialist to address nutrition, lifestyle changes and supplementation that can assist in conception. If you want to stay informed of our videos, then be sure to subscribe and hit that notification bell. We love to see you here. Natural remedies you should consider. How good is your diet? Bad diet often plays a fundamental role, as does exposure to hazardous substances like chemicals from industries. Know that dietary and lifestyle changes can make a huge difference when it comes to fertility issues, and often help with other conditions such as heart problems, excess weight, underweight, diabetes, and insomnia alongside. You may choose to undergo conventional fertility interventions, nevertheless continue with healthy lifestyles because it can improve your chance of conceiving by supporting the body through natural ways. This is by far the most important remedy. Nowadays, a lot of people are undernourished, despite being overweight. The body works in an automated way. It simply will not permit conception to happen or a pregnancy to progress if it lacks the vital substances it needs to keep a baby. Most often, you may have been advised to consider foods less in fat and high-fiber meals in an attempt to boost health and lose some body weight. Yes, weight loss has been reported to increase fertility, but losing weight through unhealthy means is rarely effective for increasing the chances of conception due to its deprivation of the body's essential nutrients required for production of hormones. Here are some nutritional ways to help support fertility. Eliminate processed foods and refined sugars from the diet. Eat more vegetables, some fruits, and starchy sources such as yam, potatoes. Increase healthy fats in the diet, especially from sources like coconut oil, olive oil, grass-fed meats, eggs, avocado, and nuts. Obtain enough protein, especially from animals fed by grass, eggs, nuts and beans. This is also essential during pregnancy as adequate protein can help reduce the risk of numerous pregnancy complications. Enjoy green leafy vegetables like lettuce, spinach, pumpkin, broccoli, cauliflower, kale, collard, chard, cabbage, sprouts, and similar veggies. Hydration is important for so many functions within the body, and also fertility. Thus, drink some water. Get insulin levels under control. If you're diabetic, keep an eye on your blood sugar levels. Take your drugs, and other recommendations to control your sugar level. Also, considering dietary measures with the above methods will help make your body more sensitive to insulin, and additionally help production of other hormones and proper function of the body. Vitamin D deficiency is quite common especially during the cold weather, and can be very detrimental to overall health. Have your levels checked to find out how much you need. On the other hand, go out and enjoy some shine from the sunlight. Folate is well known as a necessary vitamin in early pregnancy to prevent complications, but it is most beneficial when taken for several months before conceiving as well as during pregnancy. It aids cell division, proliferation and supports ovulation. It is important to know that your body may find it difficult to metabolize folic acid, and do better with folate. That's the natural form from foods such as pumpkin, spinach, beans or methylfolate. Deficiency of B vitamins is common amongst those who consume large amounts of processed foods, cereals and sugars. Eating more vitamin Bs can increase luteinizing and follicle-stimulating hormones to improve fertility. Consumption of chaste tree berry helps the body by supporting the pituitary gland and helping to lengthen the luteal phase. It contains substances that may help lower prolactin and raise progesterone. This alone has worked for some women by increasing the conception rate. Red raspberry leaf is a well-known fertility herb that is also beneficial during pregnancy. It has a high nutrient composition, sufficient quantity of calcium and it's regarded as a womb tonic. It can be seen in capsule form. This leaf can make nourishing tea either hot or cold. A simple nutritious omelette for breakfast. Ingredients: 1 egg, a handful chopped spinach, 1 small onion, 1/4 teaspoon ground red pepper, 1 teaspoon olive oil, salt to taste. Serves 1 person. How to prepare it: get all vegetables ready. Break and whisk egg until well combined. Pour in the veggies. Add salt to taste. Put a dash of oil on heated pan, pour the egg mix. When one side is cooked, flip to the other side. Serve alongside your breakfast. Here, you have your fertility-boosting omelette. If you've learned something so far, kindly support this channel by subscribing and turning on your notification bell. Remember to like the video. Going forward to the next remedy, it lays emphasis on staying active and its impact. B. Right amount of exercise every day is ideal. Getting adequate exercise is important for fertility, but too much of it can cause more harm than good. You may do well with 2 or more hours of recreational activity a week, walking, jogging, dancing, skipping or swimming, and a few weight-resistant sessions. Too much intensive exercise will prevent the body from ovulation if done always. While weight loss can greatly help fertility, having too little body fat can make the body not ovulate. C. Exposure to harmful chemicals can be detrimental. No long stories here. You should know how harmful chemicals can be. Your status may improve from minimizing exposure to household laundry substances, dishware, plastic water bottles, cosmetic and beauty products. D. Stress can disrupt your health. Cutting down stress is easier said than done, especially if you are going through emotional problems due to infertility. From time to time, you've possibly been told that if you can unwind, you will get pregnant. This may not be valid for everyone, however, reducing stress is beneficial. You can achieve this by finding new hobbies, skills or crafts. You can also go on holidays. E. Getting enough sleep. Sleep is vital to health and for the production of many hormones. Studies have shown that women with low serotonin and melatonin levels have a shorter luteal phase and perhaps may have a lower chance of conceiving. Inadequate amount of quality sleep also impairs the body's ability to properly regulate hormones such as adrenaline, cortisol and insulin. Thus, making conception very difficult. What you can do to have a quality sleep. Try to make sleep a necessity and get enough to feel rested. This may include taking a nap during the day or going to bed a few hours earlier. A totally dark room may also help melatonin levels and sleep. For some people, just good nutrition can be enough to support the body for fertility and pregnancy. It is quite great to continue these things once pregnant and not stop giving yourself proper nutrition, which is even more vital for the growth of a growing fetus and yourself. Can you get pregnant if you are infertile? Just know that there's hope. Don't quit making necessary effort. Struggles with fertility problems may be frustrating and agonizing for couples. Proper diet and nutrition can greatly help your body in conceiving and carrying a healthy baby. Thanks for watching this video. I hope it helps you in your fertility journey. See you in the next video.